Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about the diabetic foot and the lab tests that you can do to determine complications and kind of help ensure that you don't get complications. And the biggest tests that we will do are the tests for diabetes itself. And there are several different tests you can do. You can do a random blood test, for example, and really what that's telling you is if you have a random blood test and you're 200 or above, then you have diabetes. You can do a glucose tolerance test, which is a timed test. It goes over a period of time, and it's going to test where your blood sugar is. And 200 or higher is considered diabetes. 140 to 199 is considered pre-diabetes, and 140 or below is considered normal or non-diabetic. Fasting blood sugar, that's probably one of the more common ones that are done on a regular basis. And this one actually is a lot tighter. Because if you're fasting, your blood sugars should normalize. They should be lower. And really, the normal will be 99 or below. If you're 100 to 125, you have a pre-diabetes situation. And if you're over 125, so if you're 126 or above, then you have the diabetes diagnosis. And then there's also the hemoglobin A1c, which tells you where your blood sugar has been over the last 3 months. It's actually very effective at saying, okay, what's my blood sugar been for the last 3 months? And a lot of individuals, I'm diabetic. I want to keep my blood sugar, my hemoglobin A1c below a 7. Truthfully, 6.5 and above says that you're diabetic. So that means your blood sugar is still staying too high. Whereas the pre-diabetes is 5.7 to 6.4, and below 5.7 is where you should be to be a normal blood sugar. Now, why does this matter in an individual with diabetes or even pre-diabetes? The complications we see in the diabetic foot, the complications we see from diabetes, which includes poor blood flow, includes failure to heal wounds, it includes dry, cracking skin, includes inability to heal infections or heal wounds like you should, and neuropathy. All of these are worse as you increase your blood sugar. If you have a normal blood sugar or better, so if your hemoglobin A1c 5.7 or below, a 99 fasting blood glucose, a glucose tolerance test of 140 or below, all of those will tell you that you got almost no chance of the complications of diabetes progressing. Now, in saying that, all of these complications also occur in pre-diabetes. It's not just diabetes. And so if your blood sugar's even in the pre-diabetes range, even if you're managing it so well it's in the pre-diabetes range, you're still going to progress. You're going to still have the complications of the diabetic foot. So the key to this is to make sure that you lower your blood sugar to the normal range and keep it there, even if you have diabetes, even if you have pre-diabetes, because only then can you prevent the complications that come from diabetes. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 283, lab testing for the diabetic foot to minimize and even stop the progression of the complications of diabetes and prediabetes. Thank you. Have a great rest of your night.